Thousands of surgical procedures are performed every day. Each of these procedures involves intense preparation of the patient, the operating room environment, and the surgical team members who are at the sterile field during the procedure. All of these preparations have one common goal: to assure a safe, protective, and aseptic environment for the patient and for the surgical team. This educational program describes one of these preparations: scrubbing, gowning, and gloving for physicians, assistants, nurses, and other personnel who are scrubbed and directly involved in obstetrical deliveries or surgical procedures. In this videotape, we will demonstrate one method of scrubbing, gowning, and gloving, a method that employs the most current and accepted thinking and practices. A single antimicrobial impregnated sponge brush will be used for the scrubbing procedure. The assisted method of physician gowning and gloving will be demonstrated, followed by non-assisted gowning and closed gloving. Regloving during a procedure and the removal of used gowns and gloves will also be shown. Knowledge and practice of aseptic technique and donning of appropriate surgical attire are prerequisites to viewing this videotape. The basic purpose of scrubbing, gowning, and gloving is to create a system of shielding that deters microbial, body fluid, and liquid contamination during surgery. This protective system employs, first, the sterile boundaries provided by gowns and gloves, and second, scrubbing of hands and arms by physicians and operating room staff that creates a reinforcement or backup system for the sterile gowns and gloves should there be a break in the integrity of these shields. Even though skin cannot be made sterile, it can be rendered extremely clean. Surgical scrubbing removes soil and microorganisms by the physical processes of rubbing, friction, washing, rinsing, and inactivates or inhibits microbial growth through the use of chemical agents such as alcohol, chlorhexidine gluconate, iodophores, PCMX, and triclosan. Since hands are the primary surgical and manipulative tools for both physicians and nurses, most of the activity of scrubbing will focus on the hands and to a lesser extent on the arms. Antiseptic scrubbing of the hands and forearms should be accomplished in the shortest time possible, 3 to 5 minutes, with the least amount of skin irritation, and by use of an agent that leaves an antimicrobial residue on the skin. Hands and arms should be healthy, with no cuts, lesions, or other breaks in the skin surface. The wearing of jewelry, nail polish, and artificial nails contributes to microbial growth and therefore is unacceptable while scrubbing. Donning a clean mask, adjusting protective eyewear, and opening a scrub brush package all take place at the scrub sink. The water is turned on to a comfortable temperature and an initial wash and rinse of hands is done to remove superficial soil. During the entire procedure, hands are always held higher than elbows, allowing water to flow from the hands, the cleanest areas, to the elbows or less clean areas. Posture is a slight forward leaning of the body, which helps to keep scrub apparel dry. From this point on, hands and arms must not touch unclean areas such as sides of the scrub sinks, faucets, clothing, and the outside of the brush package. If there's any contact of clean hands with unclean surfaces during scrubbing, the procedure must be restarted with use of a fresh brush. The brush is picked up, water applied, and the subungual areas are cleaned with a nail cleaner. Nail cleaner is discarded. The scrub begins with the majority of time spent on the hands, especially the nails, fingertips, and palms. In a 3-minute timed scrub, 1 minute would be spent on each hand and a ½ minute on each arm. Each finger is scrubbed as though it has 4 sides. Areas between fingers are scrubbed. A few drops of water will increase lather if desired. Direction of the scrubbing procedure is from the hands to the arms, without returning to the cleaned hands. Now to the arms. Each forearm can be visually divided into 2 sections. The first section adjoining the wrist, and the second section which includes the elbow. Both wrist sections will be scrubbed before progressing to the forearms and elbows. This prevents the brush from transferring skin soil from unscrubbed arm areas back to the cleaner, scrubbed hands. Note the position of the clean fingers as they hold the brush, allowing for no skin contact as the first section of the first arm is scrubbed. Using clean technique, the brush is transferred to the other hand, and the first section of the second arm is scrubbed. Continuing on this side, the arm and elbow are scrubbed. The brush is then transferred to the first hand, and the scrub is completed at the elbow. The brush is discarded. With a slight turning of the body, hands and arms are thoroughly rinsed. Hands are held higher than elbows. Excess water is allowed to drip off at the elbows. The water is turned off. Entrance to the operating room is with arms up and in front of body, avoiding contact with any unclean areas. A sterile absorbent towel is used for drying. Hands are nested in the towel to avoid contact with less clean arm areas, and movement again is from hands to elbows. The towel is discarded. Hands are extended into and through the opened gown. And ungloved non-sterile hands must not touch the sterile outside of the front of the gown. The gown is closed in back by the non-scrubbed circulating nurse. The scrub nurse assists the physician in gloving. Once gloved, hands are kept above waist level. If required, closure of gown ties is now completed. Gowns are only considered sterile from operative area up to within 1 to 2 inches of the neckline and around the sleeves. In other words, the areas that you can see yourself. The backs and armpits of gowns are not considered sterile even if the gown is a wraparound type. In summary, scrubbing and assisted gowning and gloving consist of a preliminary wash of hands and arms, cleaning of the nails, a sequential hand and forearm scrub using an antimicrobial agent and a sponge brush, thorough sequential drying, donning of gowns and gloves with the assistance of another scrubbed person, usually the scrub nurse, maintenance of sterile technique by keeping hands in front of you, above the operative area, and by avoiding contact with non-sterile objects or surfaces. The scrub nurse and occasionally a physician team member may need to gown and glove without assistance. The gown and gloves are to be opened on a separate sterile field away from the back table and operative area. Closed gloving will be used. The scrubbing procedure does not vary and is done as previously shown. The towel is picked up, taking care not to drip water onto the sterile gown, gloves, or wrapper. Hands and arms are sequentially dried, and the towel is discarded. The gown is picked up and unfolded by touching only the inside. The scrubbed clean hands must not touch the sterile outer side of the gown, gloves, or wrapper. Arms and hands are extended into the gown to the cuff level only. Initial back closure of gown is done by the circulating nurse. The glove wrapper is opened and sterile gloves exposed. This is accomplished by working inside the cuffs of the gown and leaning forward to avoid contact with the unsterile wrapper edges. If right-handed, it is best to don the left glove first, using the dominant right hand to begin the procedure. The palm of the left hand, even though not seen, is open and facing up. The left glove is grasped at the cuff, lifted up from the wrapper, and placed over the palm area, thumb down. The cuff edges only are grasped by both hands, working from inside the gown sleeves. With a broad sweeping motion, the glove is placed over the cuff of the gown. During this motion, the left hand begins advancing through the cuff of the gown. The glove is advanced by grasping both gown and glove, and then positioned so it extends above the cuff and the cuff seam all the way around. The second glove is donned using the same steps: grasping cuff, lifting glove straight up from wrapper, placing on palm surface of hand, grasping cuff edges, extending glove over hand, positioning glove, edges extending above cuff. Closure of gown is completed. If a glove becomes contaminated or torn during the procedure, it must be replaced. One method is placing a sterile glove over the contaminated one. This procedure can be done quickly, uses the open gloving technique, and avoids exposure of the inside of the glove and ungloved hands near the sterile field. A more common method for regloving is to have a non-sterile person remove the contaminated glove, touching only the glove and not the gown. The cuff of the gown, not considered sterile at this point, should not be brought over the hand when using this method. It must remain at wrist level. A new sterile glove can then be donned with assistance from a scrubbed person or non-assisted using the open gloving method. The first glove is grasped by the cuff, lifted up from the wrapper and pulled on only up to the cuff of the gown. The second glove is put on by working from the inside of the cuff and bringing the glove up over the cuff of the gown. The cuff of the first glove is then brought up over the cuff of the gown. At the end of the procedure, used gowns are untied and removed inside out. Used gloves are also removed inside out using the technique of dirty to dirty and clean to clean. Gown and gloves are discarded before leaving the operating room. The outsides of the used gown and gloves are considered contaminated or dirty and should not come in contact with clean scrub apparel or hands. The mask is removed outside of the operating room by handling only the strings and not the contaminated face area. In this videotape, we have discussed procedures that help to reduce the risk of cross-contamination during surgery: scrubbing, gowning, assisted and non-assisted, and gloving, assisted and non-assisted. Both the closed and open methods of gloving were shown. Regloving during a surgical procedure and the removal of used gowns and gloves were also discussed. Forefathers of modern surgery implored physicians and nurses to do no harm when caring for patients. Contemporary scrubbing, gowning, and gloving, when done with thought, reason, and diligence, decrease the risk of this harm and help to provide a safe, protective surgical environment.